This meeting is now being recorded.
Hi, I'm Dr. Tona Leiker, and I am presenting today on the dynamic tension between opposing elements, the lived experience of CNAs in nursing homes. This qualitative study was conducted by a research team of doctoral nursing students and their affiliated faculty in a PhD in nursing program. The purpose of the study was to understand the meaning of CNAs' experiences in a nursing home setting. Lifting, bathing, wiping. There's a critical shortage of CNAs, especially in the Midwest. CNAs provide 60 to 80% of the total nursing hours for resident care in our nursing homes. Yet, the average CNA turnover rate in Kansas is greater than 100% annually. The study was conducted after receiving human subjects approval through the university's IRB review board. The sample and data collection included 4 neighborhoods in one nursing home community. From each of the neighborhoods, one CNA was selected. There were 4 procedures used during this study: 32 hours of general observation, 32 hours of individual CNA observation, 8 formal CNA interviews, and multiple informal interviews with people in the nursing home. There was a clear line that was divided in this study between the sample and data collection and what was allowed. The qualitative researchers were not allowed to participate or observe any private care provided by CNAs in the nursing home. All of their observations were done from a public or community perspective. If you look at the 4 procedures that were utilized, and you realize that there were 4 researchers who participated in the direct observations and interviews, you will then note that each researcher conducted 8 hours of general observation in 2 or 3 settings, 8 hours of CNA observation, typically in 2 4-hour blocks of time, and 2 CNA interviews using the same CNA. So 4 CNAs were interviewed twice. The data analysis process was a qualitative content analysis. This included reflective journaling, participant other dialogue, triangulation, coding of data, peer debriefings, and member checks. These were done as a part of, again, a doctoral nursing program, and so each week after the data was collected, there was discussion as a part of a structured course project. The findings: balancing dynamic tension of multiple opposing forces. The dynamic tension is a constant and necessary force which helps to maintain a balance between opposing elements or tendencies. This definition seemed to align very closely with the qualitative findings of the study. Dynamic tension, balancing it, multiple opposing forces. You will see in this next diagram, balancing the tension became what the CNAs did between 2 cultures in which they lived, working in an institution and participating in a community, the transition of care of the elderly in nursing homes. Working in an institution, the things that we heard were the needs of the institution must come first. The nurse tells me what to do. I must follow the rules. I must be efficient. I am an unskilled worker. I am at the bottom of the hierarchy. My voice is silenced. I should not get too attached to my patients. I am judged by how much I do, and I am an expendable worker in this industry. Where on the other side, the development of a community and participating in a community, in the community where our elderly lived, the CNAs talked about the needs of the residents come first. My residents tell me what they need. I must be flexible with them, and I must be patient. I am an expert on my residents' care. I'm a key member of the team. My opinions are valued. My residents are like members of my family. I am judged by the quality of what I do, and I am an indispensable member of a community. You can see this dynamic tension creates a rich and diverse environment for the organizational culture. So this tension between the conflicting cultures was explored a bit further, balancing efficiency and patience, being not too fast and not too slow. It was observed with these types of data. Small bites of pureed food, a half spoonful at a time, was raised to the resident's lips. She gently and quietly was told to open your mouth, bite by bite. Open your mouth. It was if no one else was present in the room. Yet immediately the CNA attends to another resident in urgent need. Patience, not too fast, not too slow, balancing efficiency in the work that they do. Discerning, recognizing patterns, rhythms, and changing health status. The CNAs seem to be very good at this. As one gave an example, she had a broken hip. There I was walking her with that broken hip, and I kept telling them, you know, I was so mad I was crying. I could have hurt her, even worse. You know, now she's in a wheelchair. The CNAs clearly talked about how they knew their residents and knew when changes occurred in their health status. Valuing the CNA and the charge nurse, tension between them, valuing the resident and the CNA. The tension between the charge nurse and the CNA was, I was really mad. You know what? Listen to me because I am with them. I can tell you when something is wrong. That keen discerning. Valuing the CNA with the residents. I come in every morning and I see their glowing faces. It's the look in their eyes. It's the smile they give you, the holding of the hand, you know. Some's able to give you hugs and some can't. It was the intensity of the relationship that they experienced. The CNA's job requires strength, a strong back and a strong stomach to provide the care that they need in the nursing home. Protection from physical injury and or emotional loss. Connection with the residents. Again, strength, protection, and connection was what brought the CNA's job together. Maintaining dynamic tension. Institution versus community. CNAs must develop high levels of awareness and discernment to balance which cultural expectation is most important at that moment. Balancing institution between community. The implications of this study include providing support for the CNAs, first by listen and respond to the concerns of the CNAs. They know their residents. Recognize the CNAs as experts in knowing. They are experts in the level of care that they provide. And involve CNAs in planning resident care. I would like to thank you for listening to this presentation today.